What is the exact role of supplements for the children with the autism?
First thing, why it is required. Now let's go by the chain of David we discuss. Problem eaters, वो अच्छा खाते ही नहीं, they are going to end up with, they are so selective about chips ही लगते हैं, chocolate से लगते हैं, biscuits, उनको कैसे मिलने वाला है? So we are going to have issues with that problem eaters. Now diets like GFC है, GFC diet करने में problem क्या आता है? Again we are not milk कम हो गया तो calcium and milk related issues कम हो गए. So GFC मैं बार बार बोल रहा हूँ, all these diets have to be taken very carefully and to supplement these diets with good options. Then junk food खाना है, junk food अपने आप में तो zero vitamins and minerals, but they destroy the other good things about the other good part of the diet and then the lifestyle. Fixed routine, कुछ बच्चे लोगों को एक जैसा ही एक सूरी खाना लगता है, हमने डिस्कस किया इसके ऊपर, रिपीटेटिव ईयर, ये बच्चों को वापस they are not eating everything and that creates a problem with that. Leaky gut, जिसका gut problem रहता है, these बच्चों को बार बार pain in abdomen की शिकायत रहती है, digestion के issues रहते हैं, they are again having lots of issues with the minerals and vitamins, so we require supplements for that. Appetite अच्छी नहीं, we require and constipation again. Now one underlying part of it, do not think of supplement again as a cure for the disease, and it is not mandatory, and sometimes these medicines, instead of helping the child, they may even create a problem for the child. Already बच्चा suffer कर रहा है, उसके ऊपर medicines add हो गए, तो the things become very difficult. And when it comes to that, we always like that. Is it always required to think of medicines? We have to think of something in the diet also. But before going ahead, I just highlighted to something new which is coming up. Now there is saying about iron is another thing which is very important cause of irritation. So we have to think of iron deficiency in this case. Also we have to think of something called as a phosphatidyl serine. Yeah, ऐसा एक chemical बनता है, chemical है, which again brain development को फायदा होता है. So these are the researches coming out. So we'll be getting some good medicines, good supplements for that, but you have to use it very carefully. Don't go on the Google, search the thing and अपने बच्चे को खिलाओ. अपना बच्चा guinea pig नहीं है. It is not a laboratory animal to be tested with all these things. Please talk to your pediatrician at least to work upon these things, and then be very vigilant. Is this thing suitable for my child? Is it helping my child? If not, within the right time period, you should stop it. It may cause problems to your child. Some few examples of these supplements in a diet.
Right. If a particular child is excessively on the milk, the child is bound to have iron deficiency. So first तो milk कम करना बोलने वाले हैं, मगर iron कैसे supplement करें? So simple dietary sources, they are the dates, the jaggery, the green leafy vegetables. Now if a parents are following casein-free diet, then the calcium deficiency तो होने वाली है. तो डाइटरी सोर्स ऑफ कैल्शियम के लिए सेसम सीड हो गया. दूसरी चीजें आप रागी इस्तेमाल कर सकते हैं. एग, स्पेशली एग व्हाइट कैन बी यूजफुल. देन यूजुअली इट इज सेड फॉर द ब्रेन. गुड न्यूरोन्यूट्रिएंट्स आर द जिंक एंड मैग्नीशियम. दे विल कम फ्रॉम द डिफरेंट नट्स लाइक वालनट, आलमंड्स. You can provide it. So including them in the diet cautiously and not in the excess. That is very important.
In nuts का एक sentence है, nuts drive you nutty. Especially those children are hyper and restless. Nuts can be a problem for them. So you have to be careful while selecting the nuts. So बहुत लोग देते हैं अपना बच्चा को ऑटिज्म क्लियर करने के लिए, ADHD क्लियर करने के लिए हम 5-5, 10-10 आलमंड्स बच्चों को खिला रहे हैं, कैश्यूज खिला रहे हैं. वार्निंग, नट्स में ड्राइव योर चाइल्ड नटी. कभी कभी नट्स रिड्यूस करें, बहुत सिंपल ट्रिक है जिससे बच्चों की हाइपर एक्टिविटी कम हो जाती है. ट्राई करके देखो. So it is not that very good.
Now coming to the next is B complex group of vitamins which includes different B1, B2, B5, B6, B12. But the simpler things to quote: milk, non-veg, green leafy vegetables. B12 sources are different, but rest of the things you can get from the green leafy vegetables and some of the fruits. Now coming to folic acid. Folic acid will be easily available from green leafy vegetables, and vitamin C, which is very important for especially iron absorption as well as for immunity of our kids. You can give your child through amla, through lemon, and so many citrus fruits. So these are simple dietary sources which you can include in the diet of the child. Yes, you can add saffron. One of the parent is asking, saffron is a natural thing, so you can add it as a giving color for the different food items.
And saffron is also known for the brain elevation, mood elevator concept to that. So we can definitely use that. But again, about these supplements, but don't ऐसा कुछ लोगों को मैंने देखा है कि 5-5, 10-10 मेडिसिन देते रहते हैं, बच्चों की टर्मी मेडिसिन से फुल करते हो. सो माय डियर रिक्वेस्ट टू ऑल ऑफ यू, बी सिलेक्टिव अबाउट मेडिसिन. हाँ, मैं भी हर टाइम, और जब मेडिसिन आपको लिखा जाएगा इंक्लूडिंग मी, प्लीज आस्क इट कि इसका एक्चुअल रिजल्ट कहाँ पे मिलने वाला है, क्या हमें देखना है इम्प्रूवमेंट, 1, एंड what are the side effects which are going to cause, and 3, definitely ask, are there any dietary options for getting the thing, so that will reduce the stress to the child as well and stress to your pocket as well. So that is a very important thing to remember. About the fruits also, but fruits I always say they are good only, but again, for example, now there is a question coming up here like that, my son likes bananas only in fruits, and is it advisable to banana? It is okay, but only banana पे रखना ये अच्छी बात नहीं. This is a typical fixed repetitive interest. So from banana, as madam has discussed last time about the food chaining nahi ho, to please go back on the website and you can find out the answer for that. And this banana you have to try to mix and match. तो बनाने के साथ आपने कुछ उसमें raisins डाल दे, उसमें किशमिश डाल दिया and grapes डाले, combination of the thing, and that is a good idea. Banana और banana like जो जिसमें सीरोटोनिन ज्यादा रहता है, ये कभी कभी बच्चों को सडनली हाइपर कर दे, इसके बाद देखना पड़ता है. एंड बनानास को थ्रोट एलर्जीज के साथ कभी कभी जोड़ा जाता है. सो व्हाट इज द बेस्ट वे? गिव दिस टाइप ऑफ फूड्स बिफोर लंच, which is a better way to give these things. And again, there is one more question about egg and all the non-veg sources. It is egg white is taken as a very good source of protein, but you have to think of that in the light of the digestive capacity of the child.
Exactly.
A child who is having constipation, egg can be creating problem for a child. A child who is having repeated episodes of indigestion and abdominal pain, be careful about that. Then some children have got egg protein allergy. You have to confirm that the child is not allergic to that. But then as an energy source, especially as a good source of protein, when you are thinking of a casein free diet, मिल्क बंद करना है, वहां पे एग व्हाइट के नहीं गुड है. एग येलो देने में जरा संभल के रहो.
Sir, especially for obese children, they need to avoid egg yellow. I
always say ADHD with obesity, autism with obesity is a bad combination to manage. So be very careful about push करते रहना खाना, ये अच्छी बात नहीं है.